Welcome back, world, to Rehabilitation Revelations. My name's Chase.
And I'm Christopher. And look, today, guys, we got a very special person in my life. I know a lot of people call him a lot of different things, but I have the privilege to call him my best friend. And this is Heath Hammock with us today, man. I love you, buddy. Thanks for taking the time to do this with us, man. But really, I wanted to kind of get more of a clinical perspective on addiction, and not necessarily chemicals, but just really a comprehensive view on a clinical side of things. But just kind of leading into that, what is the most successful thing for preventing food addiction in your experience and what you do?
Absolutely. Well, thank you guys for having me on. It's a pleasure to do this. Love this dude here. He's awesome, but proud of him too. Proud of you guys, man. So with any type of addiction, food falls into the same category. With addiction, the first step and recognize you have to be aware that you have a problem. As with anything in life, whether it's food, whether it's alcohol, whether it's drug, whether it's pornography, self-awareness that there's a problem is the first step and getting on the road to recovery. And so, I feel like when people suggest that they eat their feelings, that's true. Because when you eat, right, especially if you eat foods that are pleasurable to you, whatever that may be, certain neurotransmitters in your brain are released, which causes a calming or relaxing effect. And so as you're doing this, it's basically creating an addiction because you're chasing that sense of well-being that you get with anything, right? I mean, if you're upset, you release those neurotransmitters in your brain and it gives you a calming effect. It can make you happy. And so just to answer that question, I would say that the first step would be self-awareness that there is in fact a problem.
Yeah, I got you. That was actually a pretty good answer, especially coming from that side of things. But saying say somebody, and just follow that up a little bit, Heath. So saying somebody like food addiction or whatever other addiction, is so readily available through grocery stores, gas stations, and everything. So becoming aware of that, how, I guess, for them to objectively put, because you don't know how you have a problem until you have a problem,
right,
type of thing. Right. So how will they say okay, this is where I'm at? How do they, I guess, what are the health concerns? Yeah. What are the mental concerns that say I may have a problem here that needs to be addressed?
Yeah, for sure. So, a lot of times, man, the old adage is true, right? When you're looking in the mirror, you don't, when you're seeing yourself every day, you don't recognize, in the physical form that there's a problem. But look, let me say this. The problem with today is that fast foods, unhealthy foods, processed foods, junk foods are cheap. They're easy, right? To eat clean, to eat healthy, it's expensive and it doesn't taste as good, right? So, I would say this, when we're looking at something from a medical standpoint, right, we're looking at objective findings, okay? Y'all have all heard of the BMI, the body mass index, right? Well, I'm not a huge fan of that because I don't think it takes into a lot of the muscle mass and stuff. So you got a dude who's obviously in phenomenal shape. He's going to be considered overweight. Yeah. But, when your BMI starts rising, right, and most people today are pretty self-aware. Basically, it takes your height and your weight. You can Google any type of quick BMI calculator and it's going to spit it out. Anything above 30, objectively, you can look at and say, hey, look, there's a problem, right? So right off the bat, you can be pretty much self-aware that, hey, look, I've got an issue, right? Now, then it comes down to making the choice to be aware that you have a problem, number one. Number two, then you have to start choosing, hey, look, is it worth it for me? Is it worth it for me to eat healthy? Is it worth it for me to exercise? Is it worth it for me to basically live, especially if you have a family history of cardiovascular disease or you have a history of high cholesterol, high blood pressure? All of those things combined basically show, hey, look, that is not conducive to longevity of life, right? So when we're looking at it from a medical standpoint, we're looking at, hey, look, what is the overall picture, right? So we're looking at BMI, we're looking at your blood pressure, we're looking at your family history, we're looking at your diet consumption, and that's why so many people now, I hate to say this because I got a weight loss clinic, but so many people are going to these medicines, right? But the problem is that usually doesn't start affecting people until they see it, right? Yeah. And then it's too late because by that time, everybody's worried, well, what am I going to look like in a bathing suit? What am I need to look like this person, right? Yeah. So then it's all physical part, but really we're most concerned with, hey, look, you're overweight, right? You are eating Big Macs every other day. And look, I get it. It's cheap, it's easy, it's quick, it's fast, and today with everything being so expensive, you can go feed your family by stopping at Little Caesars and picking up 2 pepperoni pizzas for $11. So it makes sense financially, but it's a price just like any other addiction that you have to be willing to pay and say, hey, look, all right, now this time, instead of picking up this Big Mac, I'm going to go and I'm going to buy some fruit. I'm going to buy some vegetables. I'm going to try to, instead of eating candy bars, I'm going to eat string cheese or I'm going to eat boiled eggs. And so it really becomes a lifestyle modification that you have to adapt and be willing to go for, because if it doesn't mean something to you and you're doing it to please others, it's probably not going to work.
Yeah, and that's perfect kind of transition in the next one. So in your experience and what you see day to day, Heath, in Western medicine, is it almost beneficial to keep people unhealthy?
Well,
well,
that's a good question. So, as far as you look, let's be real, right? So people that are overweight that have comorbidities, and what I mean by comorbidities are high blood pressure, high cholesterol, diabetes. Those things obviously keep you coming back, right? Because they have to be managed. Yeah. So from a provider standpoint, that's a great question. From a provider standpoint, when I'm looking at managing X person's health, right? Say that they are overweight, right? And most of the time a lot of our problems stem from being overweight, right? Yeah. You have a higher propensity to have high blood pressure. You have a higher propensity to have high cholesterol. You have a higher propensity to be a diabetic, right? And all those things take monitoring. So when we're monitoring you, we have to monitor your growth, all right? So are you controlled? Are your diabetes controlled? Is your blood pressure controlled? Is your cholesterol controlled? If not, we get graded on those type of things from an insurance perspective. So we're kind of held liable by the insurance companies to say, hey, are you properly managing this? Like for example, diabetes, are you checking your feet daily? Have you had your eyes examined? What is your sugars? Are they running high? Are they running low? Are you tolerating your medicines well? And so it's kind of a complicated type of perspective, but I guess if you're looking at it let me reword it this way. Is obesity a problem that, with people having such food addictions, that it adds a little bit of a burden to the healthcare world? Well, it certainly can if you look at it that way, right? Because they're going to have more frequent doctor's visit, right? They're going to be on more medication. Yeah. So then, the pharmaceuticals get involved, and then, they're going to be charged more. They're going to use their insurance more, which that's why you have it. But yeah, it is a cost. It is a cost world, but let me say this. I think every provider has to be real. Without illnesses and without that, you don't have a job, right? Yeah. So if we were all perfectly healthy, there wouldn't be a need for Western medicine, Yeah. So I guess that you kind of have to look at it like, hey, look, when I go in there and manage, I'm not just like, hey, you have diabetes, here's a medicine, good deal, okay? I like to tell my patients, look, if say that somebody comes in and they're a borderline diabetic, or hey, look, they're over, which most of the time they are overweight when they're diabetic. I'm like, look, you have a chance right now in the next 3 to 6 months to make a lifestyle change, start exercising, start eating the right food, say no to these cravings, or we are going to have to put you on a medicine. But now look, here's the flip side of that, okay? There's a lot of people that want easy outs, right?
I was just about to ask that question,
a lot of people, they're
they're
like, look, give me a pill. I'm gonna eat what I want to eat.
Yeah.
All right, so give me a pill, because I know I'm not gonna make those changes. All right, so I'm gonna go ahead and tell you up front. And so those type people are the ones that, I guess, the ones that don't want to own it. They don't want to take ownership of it. They're the ones that say, hey, look, I'm gonna be more prone to not doing those things. And I want a pill to control the way that I want to live my life, essentially. So they use it as a crutch.
Yeah, so basically, say if I was a patient, for example, so if I had all these said health problems, in my mind, I have good insurance. Why do I have to change the way I live? Because it's inconvenient at that point when I can just go to you, and nothing against you, but I can say, hey, look, I have high blood pressure. I'm a pre-diabetic. Put me on medications that I don't have to do anything. So that's kind of basically the question, where can that get better? Or where does it, where's the hang up and said like, no, you got to do this, but I need to do this. But there's always some kind of, where's it missing though?
No, that's a great question. And here would be my response. And this is what I tell my patients. So basically, like you take kind of like a jelly, this is going to sound goofy, okay, but kind of follow me a second. Like a jellyfish, right? A jellyfish has the main core that looks pretty and it has all these tentacles underneath it, right? Well, when you're looking at managing somebody's health, okay, like most of the time, not always, but most of the time, if somebody's overweight, all right, say that a person's 100 pounds overweight, all right, say that person loses 100 pounds. There's a phenomenal chance that they're going to come off diabetes medicine. There's a chance they're going to come off blood pressure medicine. Yeah. There's a chance their cholesterol is going to go back because you don't lose 100 pounds, aside from surgeries and stuff, unless you're doing things that are conducive to healthy living, right? So to answer your question, most of the time we're treating your blood pressure. You're overweight, right? And your overweight and obesity has led to high blood pressure, high cholesterol, diabetes.
Those are byproducts.
They're byproducts
of what the main problem is. Yes.
Correct, because diabetes, let's just say this, diabetes type 2, and we're bad about this in the South, right? Because we love our foods, fried foods, all the foods that make us biscuits and gravy.
It's our culture.
It's a culture.
It's a culture.
It's a culture. That's why in the South we're fat and we're unhealthy for the most part, is because it's a cultural thing, right? Yeah. And so what we do is, instead of treating the root of the problem, okay, we are focused on treating all of the interwebs instead of focusing on the main issue, because that's too complicated for most people to want to do.
Yeah.
So life's busy. We get it. You work, right? And then it's like our health most of the time gets put on the back burner because kids have this, kids have that. We got school function here. We get off work late here, and it turns into an excuse fest instead of ownership of a problem.
Yeah, and I will say this, and you don't have to answer this. Obviously, you don't want to. At times when you're consulting with a patient, Heath, are you handcuffed in what you, I guess, withholding information from them because of the insurance companies or whatever else it may be because of said circumstances? You're like, okay, I don't want to tell them this because I'll get ticked off by the insurance companies or whatever. Yeah. So are you having to walk a kind of a fine line at times?
Yeah. So here's the answer to that. So a lot of times if somebody comes in, right, and you kind of have to fill each patient out, right? There's some that are easily offended, okay? But then let me get to the medical side of this. So that's a good question. And here's what I would say. A lot of times there are issues with putting you on a medicine that I feel may be best for you, because of your insurance plan may not cover it. Does that make sense? So like, say that you needed insulin and I wanted to put you on this type of insulin, but we can't get your insurance to cover it. That's when you kind of run into some of those insurance related complications. More so than insurance kind of dictating to us what we do per se. They do in a roundabout way because they grade us based on how well your levels are achieved, but sometimes it's a little bit of an unfair game because I could get you controlled if I had access to this medicine for you.
Yeah, but you don't have it, so
I'm handcuffed a little bit by that fact, yes, a little bit on how you start people off, what you start them out on, and X amount. I mean, most of the time, let's be real, insurance companies want you to start out. Now look, there's a medicine, everybody knows it for diabetes, metformin, right? That's what you should put most people on. However, there are times like type 1 diabetes, metformin, you don't use that, right? You use insulin and you use other medicine, other agents and stuff. But yeah, I mean, I think it's more so of, insurance companies, they can be difficult, right? But it's not like they tell you what you can do. They just let you operate within a parameter, if that makes sense.
So how do you navigate when somebody, like a patient, okay, they come in like, this is what I want to do. And you're like, no. Like, I'm trying to look at what's in your best interest. How do you start navigating those things? And is it just the rapport? Like, how do you, all those channels from the insurance to what the patient wants to you as the expert who's saying like, no, you don't see what I'm seeing. You don't see what I'm seeing. But how do you start navigating those things?
See, I kind of have a question with that.
Yeah.
So, kind of what he said, and do people kind of challenge your what you know in your field, like
Yeah, they can.
with the internet,
For
like
sure.
what they're like, no, I have this, and do they kind of like challenge you in that? It's like, well,
Yeah.
I looked this up, I researched it.
Yeah, so certainly, it's gotten so. Yes, to answer the question, yes, obviously everybody's going to Google stuff, right?
Right.
And but I will say this: this is my answer to that, right? As a medical provider, knowledge is power. Okay, so this is what I've trained to do. This is what I have studied and put many, many, many years
Yeah.
into. I've put years of training, reading, studying, but I've also had years of people that are a lot smarter than me pouring into you. And so basically, when a patient comes in, they will challenge you sometimes,
Yeah.
right? But most of the time, I can kind of flip it back on them because I'm like, okay, but I know that you looked at this, but there are hurdles that we have to go through. Like, yes, that's a great medicine, and your friend may be on that medicine. However, we're going to have to navigate this to get that medicine approved for you because look, and I tell them this all the time, look, if you want that medicine, that's fine. I can write it all day long.
Yeah.
But you may go to the pharmacy and find out that it's $1,000.
Right.
So if you want to pay $1,000 for it, go for it.
Yeah.
Okay. So
You wanted it.
You asked for it, right?
Yeah.
You're
And
the
so-
expert now,
Yeah,
buddy.
you're the expert.
So, Here you go.
but look, it's great that y'all are bringing this up because I do feel like a lot of people have this. They come in and they have this expectation that basically we're part of the underworld, I guess. That we're part of this mafia that basically wants to poison everybody and control everybody, and really, it's quite the opposite. Because now, look, let me say this: do I disagree with our foods and stuff like that? 100%. Like when you have 9 and 10-year-old girls menstruating, that's a problem. And it's a problem because of all the hormones and stuff that we pump into our foods.
Right.
All right. But that's kind of a different story that we can kind of get to a little later. But, there's carcinogens in a lot of the stuff that we eat and a lot of the stuff that we drink.
Yeah.
And so that comes down to the organic side of things. And like, yes, that is better, but guess what? You're going to pay for it.
Yeah.
It's not easy accessible. Like you can't go in, but like Whole Foods, right? That's where there's great fresh stuff, farmer's market, all that stuff's good. But most of the time people don't have the time. They want convenience, right? They want to go to Walmart. They want to go to Target. They want to go somewhere like that, quick, close by the house. And they want to be able to pick up stuff. But sometimes cheaper is not always better, but I understand that it's a barrier. It is a barrier that we have.
And two, I want to our culture today is based around convenience, right?
100%.
And all these, no offense to anything else like they're out there. Well, I don't care if it offends you, but like these urgent cares, we'll see you in 20 minutes, we'll get you in and get you out. Well, that's not always the answer
Correct.
to these other problems going on.
Yeah.
So how has that, in your practice and, the clinics that you run, how do you see that culture of immediacy?
Yeah.
Right now, I want it fixed right now. I'm paying my money, blah, blah, blah. But it's like, I can't fix this right now. There's so much more
Yeah.
going on. So how do you navigate that, first of all? But how much more often are you seeing that now today?
Well, it's challenging because you're right. Everybody wants the instant gratification, self-gratification. And so it's like people have unrealistic expectations sometimes. Like, most of the time they can come in and they, if you've got a cold, the flu, strep throat, whatever it may be, we can get you in and get you out quick. But when you're dealing with complicated issues, sometimes fast is not always the best option,
yeah.
And so, but I'll tell you,
And convenience is not always the best.
correct. But a lot of times, man, their patience are not great. So a lot of times you can kind of help some of that with scheduling appointments and, having a set aside time slot, because like you said, say that you've got 40 people in the lobby and they're there for illnesses, and then you got Papa Joe over here that wants to come in and talk to you about all this stuff. Well, hey, look, man, I got 40 people, right? So it's going to be a little bit of a wait for you to get back here. I want to be able to take time with you, but you're going to have to schedule an appointment, because if you just walk in expecting me to take 30 minutes of my time, that's not realistic.
Yeah.
So a lot of that is, but I mean, a lot of time, people have gone to urgent cares and stuff because of convenience. I mean, they can get in, get out quick. And look, I'll say this too. There's the amount of primary care providers has drastically decreased because of insurance pressures and because of, it's a financial thing. I mean, I'm just going to be honest, like it takes a lot of time. So your patients that you can see per day are going to go down compared to if I've got 25 patients that have COPD, diabetes, blood pressure, and you're trying to manage all those chronic issues compared to I got 50 people over here that have ear infections, sinus infections, I can boom, 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 get them out. They're happy, they're content, and you don't have to worry about the insurance.
And plus like the long-term
Correct.
Kind of
it's a boom,
follow-ups.
Boom. Yes.
Yeah, the follow-up.
Get you in, get you out.
Yeah,
Everybody's happy.
Yeah.
You get your shots, you get your medicine, and you're good to go.
Yeah. So I guess too, man, just say that somebody that's completely ignorant to all that, food addictions, how things work. What is somebody like an average Joe, a guy at the ballpark, the mom that's super busy and everything, how can they, if they're having some of these issues, or their kids or their husband or their spouses or parents or whatever, what is one piece of advice or a couple pieces of advice you could give us and them to help manage those things throughout their life?
Like managing chronic issues.
Yeah, to help them without, because they don't have the time, like you said, to really do those things. So what are some things that they can start taking that control back to them and say, I can start doing these things myself? Well,
here's the number one thing that I would say, right, is primary prevention is best. What I mean by primary prevention is take charge of control what you can control, right? Yeah. You can control what you eat. You can control your diet. You can control and manage a lot of those things before you ever have to go to a doctor, right? Yeah. But what I'm, and that plays a lot into it, right? I mean, but if you do have to go, screenings are good. So you can go and get a screening where you get your cholesterol, you get your blood pressure checked and all those things to prevent later ongoing issues that are going to require more frequent visits and stuff like that.
Yeah. I got
so that's a lot of healthcare is now going focused on that because of the burden of healthcare, right? So now look, there's certain things you can't control, accidents, injuries, illnesses, etc. But as far as addiction, like obesity, because I think that we're kind of focused on.
How can you manage stress too? I mean,
yes.
Now, some things you can't. But
there's
that's a huge thing too. People
I feel like stress though, it comes from like your inner self, because you put more stress on yourself than really any your job or anything. I mean, you can your job can stress you out, but you put yourself in those situations, right?
Correct.
I'm saying medically though, like Clint, how could you help reduce these things you can control?
Yeah. So so I know it's gonna sound cheesy, but like meditation, getting by yourself. Look, some people do well with that. Some people do well with listening to easy music. Some people do well with working out. Some people do well by punching bag, physical type of activity. Some people stress reduce by hanging with their kids or hanging with their friends, going fishing, doing things that, look, we all have stress, right? We all have anxiety. We all have things that we can't control a lot of times. And so, one of my biggest things I would say though is your relationship with the Lord. That would be probably paramount, would be, now look, I'm not saying that Christians don't have anxiety and we don't have stress and all that. But I would say that, your faith can help with that. And then, you have to just kind of find things that you can de-stress with, that, that you don't come home and go to alcohol, or you don't come home and go to food, or you don't come home and go to pornography. That's what I would say.
Yeah, gotcha.
And you kind of, just with the alcohol's perspective, because y'all talked about the foods as well, I think I talked about it before, it's where people run to it because it's so easy accessible.
Correct.
Or like you can stop at a convenience store, you can stop at the grocery store, and while you're buying these foods that you're really not supposed to eat, well, there you are. You have a whole beer section, wine.
You have a whole sweet section. You have all these. They're so accessible.
Yeah, and and that's where people start thinking that I think people forget subconsciously. They're like, they just think it's okay. Well, it's there. I can buy it just like I can buy a bag of Cheetos,
But here's the danger in that, though, and this is what we see so often, is it's a temporary fix, right? And so this is what happens. You come home, you're anxious, you're having some stress, you drink some beer, or you drink liquor, whatever you drink, right? So then day 2 comes on and those anxieties and stresses are still there.
Yep.
And so instead of you tackling them head on, you're like, man, all right, I'm going to hit the suds, right? I'm going to get another drink. And then before you know it, you're having to do that
every day
on a daily basis.
That's where
control your anxiety and your stress. And, and then before long, right, you're an alcoholic. You have to have it to function.
Yeah.
And then it becomes just this vicious cycle. Look, nobody wakes up saying, man, I'm going to be an alcoholic, right? Nobody wakes up and says, I'm going to be a drug addict.
Absolutely.
And so, it's these things are very subtle things that lead to issues, and if it hasn't caught up with you yet, I promise you it's going to catch up with you. So, that's you're right. It's and listen, now I would throw this back on those type of companies, right? They market it all the time as this great, wonderful thing, right?
Yeah.
But for somebody out there who may have a weakness, right? That's a concern. You take cigarettes, right?
Yeah.
They're highly addictive, and they lead to, now we got vape pens, and I get it. Look, vapes have turned into one of the most popular things that people do.
People that didn't smoke
don't smoke.
Or vape, they vape now.
And those are easy accessible for younger generations.
We've seen it, man. They're starting in middle school doing these things, right? And I'm talking about marijuana in these things. Okay, so these kids are very smart. And look, you can't hardly smell them. They don't make you stink like cigarettes do. And you just, it's not like you can just puff on it anywhere, man. You're at work, you get stressed, you go in the bathroom and take a few puffs, man, or walk outside and do it, right? I mean, but look, anything like that's habit forming, there's dangers associated with it. And like, I would liken it to this, like back when everybody our grandparents, right? Smoking was a thing that you just did. It was a socially, they actually recommended it. And we didn't know the harms of it. Now we're like, holy crap. Well, I think that we're going to look back on these vapes, man, and we're going to say, holy crap, man,
It's going to produce more things that we haven't seen.
Yeah.
You know what I mean?
Yeah. 100%.
And I know too, Heath, switching gears a little bit, I know we've been talked about food addictions. But so in your practice and everything, say somebody, I'll use myself example, a drug addict, okay? You obviously know somebody's addicted to drugs, okay? They're coming in there, I wouldn't say they're drug seeking, but I'm talking about the whole everything. So in the clinical, the medical side of things, what not only can Heath Hammock do better, but what do you think the community as a whole to help stem that? Really, it's a freaking crisis.
It is. I agree.
You see it every day, man.
Every day.
You see it every day. So what's something you can do better, the medical industry or whatever you want to call it can do better in identifying and getting and steering these people to the right or, a different way than rather just popping them out every 30 days type and keep them addicted to it. Because then I don't mean to cut you off. When I got cut off, I turned to the streets.
Yeah, and that's a lot of what we see now. All right, so number one is I think that you have to find common ground, right? As a provider, look, I've never had a drug problem, but you're my best friend and you did, right? But me and you still, I've always loved you.
Yeah.
I think that you have to understand that, look, nobody, when you have an issue, whether it be drugs or whatever, the person knows that, right? And most of the time they're shameful and they understand it, okay? And so I think coming off, finding common ground, being non-judgmental, being approachable, that doesn't happen within a 5 or 10 minute visit, right? But I think that a lot of times, man, it's so important to tell people hey, look, man, I've got so-and-so in my life that I know that you weren't born this, with this addiction. I know this is something that you regret. I know this is something that brings you a lot of guilt, okay?
Yeah.
But let me tell you this, man. I got friends that have overcome this, and you can too, right? And so I'm not telling you it's going to be easy, right? But it's something that's going to be a very difficult road. And look, let's be real. You're probably going to fail. Yeah. You're probably going to fail a time or two. Unfortunately, sometimes people fail and it costs them their life.
Yeah.
All right? But I think that just encouraging them. Now, listen, let me say this too, though, okay? I don't think that the answer all the time is just finding a different solution, such as putting them on a different medicine to fix that.
Get them off of it completely.
Correct. I think that it takes willpower on the person's part. They have to be around people that are like-minded like them, that struggle like them, because they don't want to feel isolated. There has to be an environment where it's a non-judgmental type environment, right? That they feel like they can be themselves. Because look, most of these people that have these issues, and I've said this all along, are some of the most talented people in the world.
Yeah.
They really are.
Yeah.
I believe that 100%. And for whatever reason, like they've just been dealt kind of a crappy hand.
Yeah.
Sometimes a lot of addiction is genetics.
Yeah.
So if you've got somebody in your family, a dad, a mom, whatever, a grandparent, that has struggled in the past with addiction, you're more prone to it.
Yeah.
That goes with anxiety too.
Yeah.
So these are things that people have to be willing to approach. And, like I think it takes a multifactorial approach, such as, faith, such as people that share the same common interest as you, such as people that feel they're in a non-judgmental environment, that they're free to be themselves and express themselves and take as long as they need to take. And, and I think that we need to make a lot of this stuff more accessible to people so that it's not so, a lot of times I know the financial part of it can steer people away, or, hey, look, sometimes people, they don't want it. They don't want to get free, right?
Yeah.
They like it. They like the way it makes them feel.
Yeah.
So, but no, I think as a provider, I would say, look, we got to be a little less judgmental, and we got a little bit more, have an open mind on things, and we got to have a little bit more sympathy and empathy to these people. That's what I would say.
So do you think, and this is just a question, with your patients, do you recommend going into like programs like we did, or is it just kind of, or do people just kind of jump into with opiates and stuff like Suboxone or methadone, or is that like they're just your first cue, or do you recommend going and trying, like a program of some sort?
No, that's a great question. So I'll say this. I think that people that I highly recommend what y'all did, like the Foundry and these other faith-based places, because I think it tackles the problem from multi different directions, right? I mean, I'm assuming, and I don't know this, but I'm assuming that they probably have some sort of detox associated with that place. So
they don't do it, but they send you to places.
They outsource it.
Yes.
They have.
Yes.
So that I would recommend that, because I think that if you just throw a pill at somebody and you don't remove them from the environment so that they can get well, because look, let's be real, like these people are ill, right? They're ill, they're sick, and sometimes, man, a pill itself won't fix it, right?
No.
I mean, so, you have to take an approach like, hey, look, like you can't treat addiction like you treat strep throat, right? You can't treat addiction like you treat, an ear infection. You have to treat addiction like you would diabetes or high blood pressure or obesity, right?
Yeah.
It's a very complicated thing that's like, hey, look, man, can medicines help? Sure.
Yeah.
Does counseling help? Sure. Does faith stuff work? Sure. Does like-minded people that are going through the same thing you're going through help? Yes.
Yeah.
So that's what I would say. So I'm very pro that, and very pro resources like that, and very against just throwing medicine at somebody for that reason.
And kind of leading up to that with my next question, if they do say like they didn't want to go to a program, what are the negative and positive effects for like Suboxone or methadone or whatever you go with into that kind of stuff?
Yeah. So let me say with Suboxone has a very bad rep in the community, but it can be a very good thing for somebody, right? And I was sharing earlier, Suboxone. At first, we thought that basically it was just another form of messing with somebody's addiction. Okay, like another habit-forming medicine.
Yeah.
But studies and stuff have actually shown that it can actually heal receptors in the brain that opiates attach to. It can, here's the con to that though. When somebody gets to a place to where the receptors are healed, and look, this is individualized, right? This is not something like it may be.
It's not a blanket.
It may be 3 months for you, 6 months for me, 12 months for you. But when a person reaches that place of, hey, look, okay, I think I'm good. I think as providers, we do a bad job of slowly titrating them off of the medicine. Right. Okay. for whatever reason, I'm not going to throw accusations. It is a very lucrative cash business. And,
100%.
you know, the more people you have, the more money you generate, you know? And so, but if you're asking me, you know, is that better for people? I think that if it's intended for the right purposes, it can be. Now, methadone is a lot harder to come off of.
Right. It's the hardest thing.
Yeah.
Per se, you can say it's the hardest thing to come
if
off.
people, they don't hardly ever come off of it.
Yeah.
Didn't mean to interrupt you.
No, go ahead.
It's so, I mean, but with the abuse part, do you see more of the positive effects for people, or do you see more abuse than, say, helping for people?
Yeah, I mean, I've seen both ways. I think that if people take it for the reasons of, hey, look, I'm going to use this as a bridge, and you go into it knowing this is going to be a bridge, then I think it can be successful. Yeah. But do I think people use it as a crutch? Yes.
They're just replacing this.
They do. But let me say this, though. I had much rather people be on a medicine like Suboxone than be injecting heroin.
Right.
All right. I mean, at least Suboxone is a controlled environment where, yes, you're getting it prescribed to you. People are doing pill counts. People are doing drug tests. They're monitoring people, and they can be, look, I know people, lawyers, people on TV, news anchors like that are on Suboxone and you would never know it.
Yeah. Right.
But, you know, and I had much rather them be taking Suboxone and be functional than to be in the morgue.
Because you can't overdose on it, right?
You cannot overdose because you only reach a certain level of, say, euphoria with it. Now, you know, if people are going to be disappointed if they're taking Suboxone for the purposes. Now, look, you know, y'all know this. Like, people can alter that stuff, right? I mean, they can alter the medicine itself, and you know, they can. If you're going to abuse something, people are going to find a way.
Oh yeah, no doubt.
You know? But I think that sometimes, though, that puts the responsibility back on the patient to say, hey, look, like, I know going in, yes, I have a weakness, and hey, look, I'm not going to get cold turkeyed. Okay, I'm going to take this substance knowing that it's a bridge to help me get to where I want to go, right? And that's how it's supposed to be, right? It's a titration up, we get to where we want, then it's a titration back down and you're coming off.
Right.
That's how it's supposed to be.
Is there a strategic thing y'all do whenever you do, say, recommend it or put people on it? Is there, y'all give them a time of, like, we're going to start you on this, and then this point in time we're going to start weaning you off of it and, like, see how you feel, I guess?
So I personally don't write Suboxone, but I do know a little bit about it. And I would say this, when you give somebody, you got to be careful, right? Because you're going to throw people in detox. You're going to throw people in DTs, right? Yeah. So you got to be aware as a prescriber of that medicine, hey, look, you know, I'm going to give patient X amount of this and it's going to throw them into DTs. But, you know, we got to do this in a very controlled environment. And so, but yes, to answer your question, look, sometimes, you know, you may have Paw over here who, you know, he takes, I'm going to use Xanax as an example, takes a little half of a Xanax and he's out for 4 or 5 days, and you got Meemaw over here on 8 milligrams of Xanax and she's walking around functioning fine. So
drinking wine.
Yeah.
You know, just having a good old time, I guess.
Our bodies, the way they break down these medicines, man, is very different from person to person, you know? So, and that goes with anything, right? Tolerance can be built up with anybody, you know. Look, and I mean this respectfully, but like these chemicals that we put in our body, and I hope people understand what I'm about to say is, look, I'm a very big believer in Jesus. I'm a Christian, but like Jesus himself in the man-made form that we have, when you introduce chemicals to him, he would have become addicted to them too, right? That's just the way that our bodies and our minds are engineered with these neurotransmitters. And when you're affecting them and your dopamine's released and all these things, that's a euphoria that people chase, you know, whatever the substance may be, you know? So you just got to be very careful, you know, with doing those type of things.
Right.
Yeah. And I wanted to kind of circle back, Heath. I know a minute ago you said, you know, people in addiction, they're sick, they need help, they need to be treated. And I know there's such a stigma attached with that. Say people go into a Suboxone clinic to get help, or they're going to these programs to get help. I know a lot of people like, well, my daddy just quit drinking, or so-and-so quit cold turkey. I know that if I could have did that, I would have done that 20 years ago type of thing, but kind of, I guess, changing the mindset of like, these people need to be treated, like you said, with diabetes, or how you treat those things. But it's not looked at that because they believe this, like, oh, it's a choice. They're ruining their own lives. Kind of let them do those types of things.
Well, that's low level thinking. And, you know, I'll be the first one to tell you, until you go through something, it's wisdom to just sit back and try to understand. Because look, anxiety used to be a thing when we were coming through, man, in teenage years and early 20s, and even in your later life, you're like, anxiety, man, snap out of it. Right? Well, then when you go through it, you're like, holy crap, you literally feel like you're gonna die. Your heart starts beating out of your chest. You know, you have a sense of doom, like, oh my God, I'm gonna die.
You start thinking.
You really think you're going to die?
You start
really
thinking crazy thoughts.
You have crazy thoughts. And look, that's why people, man, commit suicide and do all these things.
That's where it got me. I got to the point, man. That's where I was.
We're all human beings, man.
And that's what we've discussed too. You never know until you're there.
Bro.
And then how you get there, you might not ever think you'll get there until you are, and you're just like, until you experience that sense of darkness, man. It's insane.
Look, man, I know that I'm sitting here as if I have it all together, but I'm here to tell people I went through it, man, and it's tough. And look, some days it's still a struggle. You know, you have to take it a day at a time. And you know, everybody looks on the outside of a person, they're like, man, they have it all together. And most of the time, dude, nobody realizes what somebody's going through.
Absolutely.
You know, and so, you know, the worst thing people can tell you when you're going through something like that is snap out of it. You know, because then you feel even more alone. Like you're even more alone. Right. And then you feel like the burden just got a lot heavier. You know, and look, I get it. That's why people turn to agents, man, to calm them down. I completely get it. But, you know, but then you're right. I mean, there's people out there, but I'll say this, man, life has a funny way to humble you. You know, and when you start throwing stones, brother, I'm telling you, man, life has, whether you believe in Christ or you believe in karma, whatever, I'm telling you, life has a funny way to come back and bite you in the butt. It will humble you quick.
You're right. That's it's very humble. It's humbled me, man, especially going through different parts in my life and getting to that point where I did think crazy thoughts. My anxiety drove me, my depression, my just who I wasn't supposed to be. Like that side of me. It's funny though, I don't want to say it like this, but it can be who you are, but also it doesn't have to be.
Correct. No, 100%. You're 100%.
But you can allow that to take over, you know, but there are different ways, you know, to get out of that, you know. I mean, by going into, because most of the time, man, like you that's why we have people like you know, and people like programs and stuff to help, you know. Y'all are here to actually generally help, you know, and you know, it's people do appreciate that kind of stuff. I think just because they think, like you said earlier, man, it's, you know, people just think it's they're just trying to get money out of me and things like that. But and I think that's what scares a lot of people to not do the right thing in a general sense, man.
Yeah, because they don't trust us, right? So then they're like, man, look, I'm not gonna go in there and listen to these dudes or whatever, man. I'm gonna go to the
quack doctor.
Yeah. I'm gonna go to the street and I'm gonna get something I know works. And I'm going to chill out, right? And that's what they do. And you know, I mean, look, I don't obviously condone that, but I certainly see how people get to that frame of mind to where they don't trust people and to sit, you know. And look, I'm here to tell you, there's bad in every profession. Okay, there's very bad in every profession.
For sure.
And so there are people that I wouldn't trust, right? But you know, and let me say this too, like going, and I don't want to go off this too far, but I just want to throw this out there. Like a lot of people are on medicines such as Prozac, Zoloft, Celexa, Lexapro, you know, and listen, you know, they can be effective for a lot of people, you know, but that's not always the answer. Okay, that's not always the answer. Right. So, you know, and you know, but look, they affect the brain, man, just like all these.
You start manipulating those things. There's going to be something else happening.
And you start trusting that, you know, more
it
than
becomes a crutch.
More than anything.
And too, like in saying that, Heath, and I was going to ask you, and I forgot about this, but like somebody says, I'm sad, I'm anxious, give me something to make me feel better.
Yeah.
You know, and I know, again, that's the culture of immediacy. I feel bad right now. I want to feel better right now. So give me something to do those things instead of saying, hey, you get 8 hours of sleep a night.
Right.
You're this and that. So I guess in the medical, the clinical side of things, why, this is an ignorant view, but it seems like if you're just sad, they're going to put you on an antidepressant.
Right.
If you're anxious, they're going to put you on that. Why is that, I guess, the answer, or people think that's the answer?
That's a great question. So first off, like there are tools, tests, whatever you want to say, like scales that we go by that, you know, that providers should be using as a screening. It's a screening. Okay. Now, let me say that. Do I sit here and am I going to hand you a piece of paper that says I'm sad most of the days and I have this or that? No.
Check if you're sad.
Yeah, because we're all sad sometimes.
From 1 to 5.
Right.
How sad are you?
I'm probably going to be blacklisted for that. But
all of them. Just circle the
I
whole
try
thing.
to keep simple things simple, right? Yeah. So here's what I tell people. Like, look, everybody's going to have some sad days. Everybody's going to have times that are hard. Everybody's going to have some anxiety. Does it affect your quality of life? That's my number one question. Is your sadness more days than your happy days? Yeah. Are you sad more days than you're happy? Or is it affecting your relationships with people? Like, does it affect you at your work? Does it affect you as a parent? Does it affect you at your job? Like, if it's affecting you and it's been going on for X amount of time, then we might need to consider a medicine. Yeah. But you know, most of those medicines are only meant to be for it's
a bridge, basically, isn't it?
Short while, yeah. And so, but look, we don't do that, right? So, you know, but look, a lot of times though, the same people that throw stones at providers are the same ones that tell their provider, hey, I don't want to come off of it, right? Yeah, exactly. Because I'm scared.
I understand there's two flips.
Yeah.
I just, you know.
No, it's a great question. I think that a lot of times, y'all brought up great questions. There's lack of trust. Yeah. From everybody. I mean, you watch the news, are they lying or are they not? Most of the time they're lying, right? And they're manipulating and everything else. So it's the same thing. But I would just tell you, like, look, you got to find a provider you trust. You got to find one that has your best interests at heart, that you feel like you connect with, that's listening to you. Because the number one complaint that I hear from patients that leave somewhere is, I didn't feel like they were listening to me.
Mm-hmm.
Yeah.
Or, you know, thank you for listening to me.
Yeah.
You know, and it doesn't have to be somebody sitting in there with you for 5 hours saying, man, tell me your whole life story. It can be like, hey, look, like I'm gonna give you as much time as I can. Okay. But what brought you in? What is the most important thing I can address with you today? Mm-hmm. You know? So
man.
Cool. Anything else that you guys want to throw off, man? Or
I don't really know. I mean, we covered
kind of a bunch of different bases and everything.
Yeah.
Man.
Well, all right. So just a quick brief, just to kind of give talking about, you know, trusting and things like that. To get a little feel about you, what got you interested in this field? Like, what brought you? Like, what made you say, oh, I'm gonna be this guy? Like,
yeah. Because Heath is that guy.
Because you're that guy.
You're that guy, bro.
You're that guy, baby.
You're that guy, dog.
No, I'm not that guy. But, you know, I think that coming out, like I was a big sports guy. Me and this dude played together since we were very little, and I love sports. But when I realized that my sports career was coming to an end, I wanted to continue something to work around sports, right? Yeah. But, you know, physical therapy wasn't an option for me because I was immature at the time, and I couldn't imagine going to school for 8 years, which I ended up doing that crap anyhow. But, you know, so then out of school, I got a job, started working at a local pharmacy, and I was like, man, this is pretty cool. And this is going to sound really cheesy, but I was like, man, like I really would like to be able to prescribe stuff someday to help people in their life, right? So I kind of did it for shallow reasons, to be honest with you. But now, like, I couldn't imagine life without doing it, you know, because it creates so many opportunities, man. And like the most self-gratifying and self-fulfilling part of the job is family members or patients that come back and thank you man, thank you so much for helping this person, or thank you so much for getting us through this, or thank you so much for just caring.
Yeah.
You know, thank you so much for anything that you can, you know, everything that you did to help us. And that's what makes it worth it.
Yeah.
You know, in the end, you know, at the
just
end
giving
of the day.
back.
Giving back.
Giving back, man. And that's all it's about, man. I feel like that's where people, you know, in your field, man, forget about that sometimes because, you know, that money comes in.
Yeah.
And then, you know, they forget about the people, man.
That's
because
right.
really what you're doing is supposed to be for the people.
Yeah.
And not, you know, and people.
And never losing sight of
right.
that. And never losing sight
Well,
of that. Dude, thank you. I love you, buddy. You're my buddy, man. I love you so much, man. I love you so much, man. Thank y'all. We appreciate y'all. Sorry about the little glitch in the camera. We'll edit that out and get it all nice for you, all right?
You'll edit out that too.
Yeah.
See ya.